and get started. And thank you, Hannah, for starting that. And right now, yeah, okay, thanks. Um, so thank you. I was looking at this AI setting that hadn't popped up before, and a friend of mine had hers engaged and selected it differently for some courses that she was selecting and teaching, and it kept popping up ever since. So I didn't want to do the incorrect thing. So we may see it on your end as well. So I'm really pleased to be here today with you all, and really looking forward to kind of discussions that we have today. And what I'd like to do is just kind of see if you all have any questions for me regarding the content to date. So we're entering into the zone of week 3 and kind of moving forward with that. So any questions that you might have related to content from last week? I've been able to, I can, as a facilitator, I'm able to go into just kind of looking at how you all are doing with kind of checking off the modules as you enter and go in at your own pace. You're able to kind of, it just kind of clicks off some of the items. Again, every module has the blueprint available to you. It has just kind of a checklist to accomplish items, task items, if you will. And then the video. So the videos are recorded by colleagues throughout the, global, working globally within the realm of healthcare simulation that are certified and experts in their field to be able to speak towards those topics. So I love that we have diverse faculty that are on the video, and then we have faculty that are also here live for our sessions, which is great. And then we had questions regarding where the postings are, and we showed those last week. So when the Zoom recording is ready, you'll be able to access that at your leisure as well. Okay. All right. So we had a great exit and then now entry from last week from an OSCE exemplar. And so when I was looking at content and such this week, I thought it would be great to bring that back because our activity starts off with us being able to look at applying the lessons learned into the application phase while also discussing some of the content, also having you all look at your own professional development sheet to kind of explore avenues for growth or areas of interest that you need to kind of go back to or incorporate or have through the lens of not your practice, but as the simulation educator, that universal lens that we all look at when we're looking at exploring this examination. And if you seek to move forward with your certification process. So what I'm going to do here, let me just check information again. Okay, great. Thank you. All right, so I have the capacity to go ahead and share my screen. Hopefully it'll show differently this time than it did last week as well. Sometimes when I get into exploring and have different items up for us to review, it goes into a different mode, visual mode for us to see. So let me just look one more time here at everything just to make certain. Okay, so this is our traditional welcome to the course again. This is module 3, and I'm really excited that everybody's back, or we have new persons who have joined us today. So thank you for taking the time to do so. And once again, I'm Kelly Rossler, and I'm one of the facilitators of this session. Something that I wanted to also just include is the housekeeping items that we just spoke about, orienting yourself to the Moodle platform as well, and also looking at if you need resources towards the end of this session. I'm going to go on the ASPE website. If you recall, week 1, that domain 1 items or resources for your practice and kind of moving forward with if you need to kind of reinforce concepts from either the Dictionary for Society Simulation, but we also mentioned the Association of Standardized Patients, and we also mentioned the International Nursing Association for Clinical Simulation and Learning. And so I have pulled up those standards of best practice that sometimes educators like to go to kind of reinforce some concepts as well. Okay, again, images are for the presentation. And again, we invite y'all, most of y'all have your names up here to be able to kind of visualize and see as well, which really creates a great networking potential. I think a lot of times for connectedness, we have students who do connect back and reach out to one another and sometimes do study groups or just in general of, hey, we're expanding something in our program and I really want to know what you're doing. Or you mentioned this, can I reach out to you? And so I think pretty much while everybody on the platform here globally is willing to kind of share and collaborate together, which is great about the simulationist environment. And so this is just another, I think, conduit to be able to have that opportunity. Okay, so this is really the large domain, domain three. It isn't really a boogerboo, but it is a wealth of content. So when you're looking at your professional development sheet and you're looking at the content for those specific domains, this is really those core educational principles that we apply to simulation. So if we think about simulation theory that we need to include in practice and also curricular development. So I should have my underpinning, my good strong bones and structure based on some theory, as well as then how do I take that and move it into my curriculum. Now, a curriculum could be at your academic setting, in your practice setting as well, in the clinical environment. So it could be you have a mobile simulation unit that you take on the road to help, or a rural health center. All of those are different avenues where you still need to keep mindful of that structure, kind of like you would with policies and procedures or that you have, or organizational requirements, accreditation requirements from universally within your countries, kind of looking at those standards of practice and policy. So when we're thinking about that, think of that universality of theory. And what we're doing is kind of here is leaning into some commonalities of theory and approaches, and then also for curricular development into practice setting. When we think about this recording on these sections as well, we have a lot of interconnectedness, and this actual presentation may go different from the blueprint. So if you're following along the blueprint, please know we're going to pop around just a little bit, but we want to be able to interlock the smoothness, if you will, or present the content in a manner that's easy to go ahead and connect the dots with. And so theory is one of those areas that we kind of start off with as well. When we're thinking about domain three, again, it's divided into two modules. I was able to share that information in my announcement to you all. So we're going to take the bulk of this week and then next week. And we're really, again, looking at focusing on that, the values, the skills, knowledge and attitudes of that educator. So when we're thinking about preparedness, or you're thinking about in your head for these application questions and you're kind of talking out loud or you're developing your exemplars. Last week, I offered a technique that other learners have done completed in the past and incorporated in their learning strategies. I'm really looking at, this is my one exemplar that may fit different areas or a case scenario. So we kind of started to build a little case scenario last week regarding practices with American Heart Association, inserting a Foley or respiratory therapist, whatever your scenario is, one that you're really comfortable with. I like to use that as a blueprint or a template to carry me through when I'm studying as well. So when you're thinking about these, remember it's that prudent simulationist or educator for responses that you're looking at for all of the applications that we're conducting or have within this actual learning module. So when we think about learning theories as well, we're just kind of dive in here. And can anybody share what are some learning theories that you like to use in practice as a whole? So I'm happy with it connecting to simulation or what you embrace in your own lifestyle for your own theory of like leadership or education, or what you utilize theory in for your programs of practice. So if anybody would like to share, what are some theories that you're familiar with that you like to use?
Personally, I kind of piggyback on constructivism,
Okay.
and I also, of course, experiential learning theory. It's very important. Um, um, also like Miller's, and what I try to do is kind of fuse these things. It's a
Yeah.
hybrid kind
Okay.
of use, but I have seen others that are very, very good.
Excellent. And you can kind of think of fr theories and framework. If we think of Pam Jeffries' theory from that she developed and then in cognition with the National League for Nursing, it's based on that constructivist approach and those concepts as well. How many of y'all have, and you may not have in your country, but in the United States and in Dallas, Texas, we have a half price books. And I have gone in when I went through my PhD program, they have like original series, and I was able to pick up a Kolb's book, one of his original models for experiential learning theory, which is pretty cool. We like different types of theories, and I ask that because it helps ground us. If you understand kind of one theory, then you can kind of bounce back and forth of, oh, well, this is a different theory, but what does that mean, and how does that resonate with me? So Erickson's, yeah. So in the context of Erickson for pediatrics, so those learning modules that we look at in, industry versus inferiority or something. I'm going to say it wrong. So okay, thumbs up. Thanks, Jessica. So when we think about that, I think I kind of apply that to my niece and nephew, great niece and nephew. So where are they in that pathway? So if you can kind of even take Erickson, you can take constructivism, you can take Kolb, and you have an understanding of the underlying, well, why do we need theory? Why is it so important to simulation? And that's one of those key components too when you're preparing is we'll introduce these concepts. So some of them have conceptual models, but I think that having an understanding of the actual theorist, the actual producers of the theory or model, and then the concepts behind it, keep it kind of linear that way so you know which ones so you don't end up cross. I think they're abstract and can cross domains a little bit, but for the purpose of preparedness, kind of keeping in mindset those individual theories that go, pretty much will speak towards application of simulation and how you learn and you teach learners something new if they're novice or experienced and how we line that up. So when we look at this particular item, let me go through here. This is the presentation that truly looks at Bloom's technology. How many of y'all here are the question writers in your area? If you guys do develop any questions or quizzes or exams for your learners. We use a lot of that Bloom's technology. Another area where we use Bloom's technology is for abstracts, for conferences. Many conferences utilize those different types of how we're going to connect with the learner as well. So I was able to just put into our announcement this past week a discussion on this actual, not the picture itself, but the actual content. So to kind of get you all forward thinking about that. But I kind of want to know, how is everybody thoughts and feelings about Bloom's taxonomy and Bloom's itself? Because our next slide here kind of talks about Bloom's. And I'm happy to kind of go over some of the concepts of Bloom's. But if it's an area for that y'all are pretty comfortable with, we don't need to go in depth with that, but it's based on the learning of the group as well. So what I can do really quick, if y'all are comfortable with that or with me doing this, I'm just going to kind of look at, we started this one, we started at the bottom of the pyramid and kind of go up as well. So remembering is kind of recognizing and recalling. And I like to use kind of lab values or different terms for that. So if I have a arterial blood gas, I know what the term is. I remember what it is for, right? I'm understanding. It means I grasp that instructional material itself. So I grasp the understanding of why we would have an arterial blood gas for a patient. And I'm going to apply some of my facts, but use that information to new situation. So if I'm have an order and I'm applying to get an arterial blood gas, I'm identifying how a student will apply this into the actual clinical setting. So it's new information but I'm taking it to similar places. So I've taken it out of the context of remembering and understanding and actually applying it. And I like that clinical setting or simulation setting is where we can apply that. But I'm also, if I go ahead and apply if I were a respiratory therapist or I'm certified to be able to draw or have a blood sample for a venous sample, excuse me, arterial sample for a blood gas, then I can go ahead and apply and demonstrate that I apply the knowledge of. I've went ahead and have that gas, and now it's analyzed, and I have my report in front of me. Now I need to break down the information of what it tells me and evaluate it in the terms of how would I then move forward with creating a whole? Like, how do I take that information and apply it to new directions for my patient? That's a different patient taxonomy use there. But when we think about this, a lot of folks use Bloom's kind of every day. So now kind of hopping back outside of a clinical example, this is for objective structured clinical exam, where last week we talked about the SP and an exam scenario. So if you all didn't get to listen to the actual video or the session last week, we kind of end towards the end of the session with that, so it ties in nicely here again. So in this section here with this example, the students must learn, or excuse me, must go ahead and look at a peer review encounter with a standardized patient. So you have a peer who's in with a standardized patient type scenario, and they must peer review this particular encounter. I look at this, if you will, contextually. Either they are looking at a video feedback of a peer, another student who is in with an SP session that was also recorded, or it's live where they're either in the room, or sometimes we have observation rooms where you can see into that section and then the actual peer is reviewing. So which level of Bloom's taxonomy would this peer review activity most closely resemble? And I talked on and on and on about the peer review because when you all are looking at, and just of y'all who provided an opportunity to say, yes, you use Bloom's taxonomy, for item writing, for taking questions, really look at the stem of the question, right? Break that down. What is the question asking me? And put it into that context. So I'll would be eager to hear y'all's feedback on which level of Bloom's taxonomy would this peer review activity most closely resemble.
I think that evaluating could be one of them. Um, Again, they are evaluating or examining information from the peer review itself and encounter, and then probably uh, they might do some judgment, but again, analyzing, evaluating.
Yeah, so it would fall into more closer to the evaluation side. You all are correct. So we got some great input on the chat as well. So it would be, wouldn't it depend on when the peer review was taking place? So one of the things which is great about this cat that you provided is when you're looking at the stem of the question to um, not go over and you're not creating a scenario, right? You're not creating new information, but truly stick within that scope of the question because they should have written the stems to clearly address and have those responses there for you to look at. Again, I don't know what the questions are because we have a firewall between us, but for that area, we wouldn't want to add extra things in there. Well, I think if I were in this situation, I would do this or what have you. So for this particular question, it's really the students must peer review. So it's really that peer review. They're completing an evaluation or a peer review on an encounter, and it just says an encounter. So we don't know where that encounter is as well. So thank you for sharing that, Kat, because it really it does help to kind of say, if I'm doing this, where, how, if I have this modality, but in my lab, we kind of do it this way. That can happen a lot. I find myself doing that with some questions like, well, this is not right because this is how we do it, or this is, so we have to look at those universal tenets in those processes. So one of the key words here would be peer review for that. Okay. So thank you for sharing. Are we comfortable with that application question? Okay. So I'm going to go kind of back to this too. So just kind of having that, if we looked at, um, I think if we analyzed a peer review would be that I'm evaluating that performance rather than analyzing or breaking down um, the peer in different type activities. So you're not really analyzing the processes that was used doing the peer review, but we're evaluating just those action items for the encounter. Okay, so here we have one. Hector was great to share with us about Miller's Pyramid being a go-to area. And so in this pyramid, it starts out again at the highest level is from no to does. And so when we think about this Miller's Pyramid, we actually have an application uh, triangle here, and you can look up Miller's Pyramid and have your own triangle as well that you would like to look at. And so when we think about this particular scenario, your learner is required, you're the faculty educator, is required to demonstrate a proper procedure to advance clinically. So a proper procedure, whatever that procedure or skill, so knowledge, skills, attitude, what's the procedure or skill to be able to advance clinically? What level of Miller's pyramid would the successful completion of this procedure meet? So if we look at Miller's pyramid, what would we think if a learner was going to complete an activity, right? Let me look back over here. Demonstrate a proper procedure. So demonstrate procedure, a skill. Where would that fall? Oh, let me see. We've got lots of, yes, shows how. Perfect. Excellent. Thank you. So we're kind of, you guys got that. So when we're thinking about the pyramid, again, fact gathering, we know it, we can interpret, we know how. So here's this interpretation again. So when you're thinking about Bloom's versus Miller, stay within the context of these particular framings and their own questions or their own areas of how they define, how Miller defines, how Bloom defines each level. And that will help you rather than kind of getting amalgamated all of them together, going, which one is this again, right? So it goes from knows to know how, shows how, and then does. Okay. And that does is really going to take you in that performance is integrated into practice, right? So kind of if I'm demonstrating a skill checkoff in my facility, we have students who need to demonstrate medication administration safely, right? So if they demonstrate that, they're supposed to know the medication, interpret what the medication is for, how to administer it if it's an IV or IM, and then they're going to demonstrate learning based on some competency format. Okay. So hopefully they go back and keep going on this pyramid to actually then we take it into that clinical practice setting to does. Okay.
I have a good question. Which one, in your experience, do you utilize more or the most in terms of skills? Like, for instance, procedural skills, putting central lines, chest tube, things like that. Is there any in particular that you prefer or would prefer to use?
So all of us in general, do you think? Or
Or I
just in
mean, if
general.
I am the
Instructor.
simulationist and
Hmm.
instructor, I guess that well, it depends. But would you prefer one versus the other, or you mix them, or
So that's a great question because then that takes us back to our level of the learner and our objectives, right? So if I had a novice medical student who was needed the skills of maybe CPR and they just came out and have their brand new BCLS or American Heart Association or equivalent to be able to lead a code situation. Hmm. I'm thinking I would like to have them demonstrate those skill sets of compression, possibly AMBU, airway control, versus being a code leader automatically. Again, it's the level of the learner. So then if I have a resident who's been here for 2 or 3 years and they're a chief resident and they've done completed codes and competent in all these areas, then that, is that level of that simulation. So you may have a simulation event where you intermingle like interprofessional practice, right? So what were those objectives? What were the roles of the learners and what are the levels of performance or understanding that meet what you seek to do. Shows how kind of skill, but does simulation. We're getting more to the what shows how with competency skills, but then we're actually doing that clinical practice that does. They're actually doing that activity. Other thoughts, everybody? I really like that question. How do you all look at when that kind of is week one again, going back to looking at how we were starting up a sim lab and we've got our equipment, we bought things and we opened it up and we're starting now with our learners. What are some of the things that you all do in your experiences for simulation that you'd like to share? That might apply to shows how does.
yeah, uh, I found something very interesting.
Hmm?
It's at some point that was basically that there are some parallels between Bloom's and
Well,
Bloom's and Miller's. So, for instance,
okay.
in creating for Bloom's, you can utilize DOS in Miller. So there are some kind of
Okay.
parallels. But when I am, my thing is when I am putting together the learning objective, it's like it's either Bloom's or Miller's or can I
Okay.
put them together? You see what I mean? It's haven't had the experience to do that in that way. So I don't know
Okay.
if you make different lists or you put the
Okay.
list together and you put Miller's versus Bloom.
It really does depend on your, again, kind of those objectives, the level of learners, the intent for those outcomes, for those learner outcomes for that activity. For the purposes of preparedness too, just make sure that you are them separated. So the Miller is Miller and Bloom's is Bloom for those exemplars. Thank you for that. Does anybody else have any strategies how you all prepare to kind of keep theories and models in your kind of your head straight, or that helps you organize your thoughts on these theories, these particular ones? I'm happy to have anybody chat or okay. If it comes to mind, please feel free to. Okay, we've got here. Okay, using those to gather data for the needs assessments. Okay, great, because that's kind of taking it back to the beginning of let's look at a needs assessment. That also takes us into a new theory. Thank you for that. Of looking at Kirkpatrick and Kearns that we're going to look at. So, how many of y'all are familiar with Kirkpatrick's levels of learning? And I apologize earlier, my mouse was doing some spaz motions there and causing the screen to bump. So Kirkpatrick's 4 levels of training and evaluation. This is going to apply to. How many of y'all are familiar with Kirkpatrick? Let me move ahead here a minute. Okay, Hector, great. And I'm going to move. Okay. So just to kind of look at Kirkpatrick, one of the things that Kirkpatrick invites us to do, Donald Kirkpatrick really devised this training methodology for appraising employees in the industrial areas or sphere. Awesome. Uh, um, Laurencia, thank you for adding that because it's helpful when you know it and then you can apply these particular models. Thank you for sharing that. One of the things about Kirkpatrick is great is it really looks at the results and the learning outcomes of that trainee, right? The learner. And there's just 4 phases. We have a reaction phase, a learning phase, a behavior phase, and results phase. I will share with you that I have seen more in the literature with simulation literature coming out where there are systematic or scoping or umbrella reviews where the authors include the level of learning because throughout time we have a lot of research that has been conducted on the reaction of the learner. So when we take it from the industry side and bring it into the education side and the practice side, we get the reaction. I'm satisfied with learning. That was great. Let's do it again. So that's that, behavior that it was very favorable. It was engaging. It was relevant is that level 1 reaction. Well, in simulation, we have completed research, right? We're confident in this and we have our reactions of self-confidence in learning and or other attributes for learning, learner satisfaction, those type of items. But gosh, level 2 wants to look at did they actually learn something, right? So did they acquire the learning? So it's great that they enjoyed the experience or they gained self-confidence, but what really was the degree which they acquired that knowledge, skills, or confidence base in their learning, right? To be able to carry it over into their practice. The behavior is a level 3 for behavior. This is when we take it over in our students, either take it into the clinical practice setting, and they do that, with their clinical preceptors or their preceptorship type environment, or it's the practicing uh, professional, healthcare professional and team who takes these learned behaviors and now kind of modifies their practice, changes their behavior to be able to then practice with high quality, whatever it was, right? Whatever the learned behavior was. They want to make sure that they're applying what they learned to their job. And then the results. Well, this is the outcomes of not only the training, but also this is the learner training. So what's the outcome of the learner training? Did this particular learner improve medication administration safety guidelines? Did they look at practice behaviors that way? And a lot of times we look at that outcome level, again, of that learner is what we're looking at. So when we think about going back to these levels and this scenario, in this particular exemplar, you have a learner that are asked to complete a pre-simulation and post-simulation knowledge survey. So a pre-test, post-test. We've had the baseline survey, and then the simulation was completed, and then we have a post-simulation of that same survey. Which Kirkpatrick level would the comparison of these survey scores meet and why? What do y'all think about this one? I'll give you a minute. Kat, I appreciate your comment that you've been using it, but didn't put a name exactly to it. So hopefully that will provide you that familiarity to be able, it won't be like a learning curve that way. Okay, we've got a couple little bit of reactions and we have some behavior as well. So when we think about this level 2 here, we have a learner who said, let's think of maybe if I give them a pre-simulation survey that's going to look at interprofessional education, communication. And I'm going to give them a survey on, please tell me your experience with communication and collaboration. And it could be, there are different ones from IPEC survey or IPEC institution, that Interprofessional Education Collaboration Council, that has different types of recommendations for survey tools for IPE and communication. So say we have the validated and reliable tool that we're using, and it assesses the learners. I believe I can communicate well. I believe I can contribute to the communication of our team. I believe what have you, or share your thoughts. That's the baseline. Then they go through the simulation that is focused on learning communication skills. Then they do the post simulation, and hopefully we would probably see after the simulation that their answers would probably increase if a more positive, if they were a scale from like 1 where there's no increase or I don't feel confident to I do feel confident. Hopefully we would see an increase in communication skills, or they felt they learned communication skills techniques better. So this actually would surround learning for this particular one. When we think about the pre-post simulation knowledge, would be gathering that baseline and attending to determine, we want to attempt to determine, did the simulation experience actually change their knowledge or their confidence? Okay, so let me go back to some of these. Okay, great. Learning, since there's not demonstration, learning because they aren't applying it yet. And then when we think about, when we think about uses for evaluation of training program outcome, do you want to add a little bit more to your comment so I can reply a bit better, Laurentia, if you're able to? Okay. And I think reaction is something to kind of look at as well for a response. For this one is for here too, they've actually had a knowledge survey. So part of that knowledge survey looks at, did they gain new knowledge? Did they learn knowledge or gain new information on the particular item for that survey? And that's kind of puts those things together as well. Okay, thoughts or more questions about this particular one? So it's just kind of fine tuning and looking at the STEM. Gosh, you know what? I have this pre-post simulation example. I'm just really, they want to really know, did they gain any knowledge? So kind of learning would be that knowledge gained. Yes, goes back to the stem of the question, definitely. So taking a chunk out of that stem of the question and kind of highlighting those areas of what do they want us to look at. Thank you for directing us back to that. So the stem, and then how would we apply it? Okay. Okay. So the 4 levels, again, Kirkpatrick. There's a great website on Kirkpatrick that you can go to as well. I do know that there is a new Kirkpatrick type of terminology um, uh, on the website. It'll say new Kirkpatrick or something. And I think what happened is they closed down an old one and they put in a new one. Maybe it's family or another company representative, but it's still inherently these core items. So just don't, if you go to the website and you see that, it's like, what's happening here? These are the 4 levels. Okay, so this is one that we're looking at that we're applying Kearns, Kerns. This is actually 6 phases that are kind of linear in process, but once again, they're all interconnected. So this may or may not be a new curriculum design element that you all are familiar with. But this particular one was developed, and it's more of a logical, systematic approach to, again, a linear side where we can see the arrows going from problem identification to a targeted needs assessment, to goals and objectives, strategies that we're going to identify to use, how do we implement, how do we evaluate, and then back to problem again. Okay, so it's a circular pattern. But one of the things on this framework is that, we have a goal with our education, right? We have our objectives and our outcomes and our goals attainment that we would like. And so if we're looking at goals that we seek to accomplish, well, how can we do that in this process? And if we kind of have a breakdown in one area, how do we go back to or reference that particular domain? So kind of think of these is if I have problem identification or general needs assessment, specifically look at what is involved with a general needs assessment or identifying a problem. I kind of think this is an evidence-based practice type model as well, or a research model for those of you all who conduct research projects. Well, gosh, we have to find a gap in the literature, right? We have to find a gap in our learners, our knowledge of our learners. What's our feedback? Maybe it's data that you utilize in your institutions, like codes, time responses, medication administration timeliness, communication techniques in the operating rooms using the kind of the stop procedures that your timeout procedures, or they have different techniques that we use for communication. So when we think about these linear steps, kind of be familiar of those steps, but if there might be a concern or content on one particular issue, look back to, well, where did the issue originate from? So this is how I'm going to kind of show this as an example, because we can have that kind of multi-directional going back and forth. And I think of this when you guys are having your examples that you are probably using to kind of write about, like if I applied Kern to my example or case study of simulation that I like to use. If I had an issue with my modality, right? The learners gave me feedback on modality. I could go back to this model and say, okay, well, what did we have? What area speaks to modality or educational strategies? So I'm going to have y'all read this application kind of question. And it's really looking at a pilot testing. So pilot testing is huge within simulation, right? Where we want to make sure that we can pilot test our scenarios to kind of identify little loopholes or things that might go awry, or we can anticipate the best, power outages, this, that, what have you. So in this particular one, while you're reading it, it's asking you to look at discovering that you discovered that the activity did not meet the intended objectives. So you're pilot testing it. It didn't meet the objectives based on the model. As a simulation educator, where would you begin again on the model? So I'm going to go ahead and show this again. Okay, so I've got goals and objectives and I have targeted needs. For when we look at this particular question, I appreciate the differences in thought. And when we think about this particular question, we have the simulation already ready for to go, and we as educators are pilot testing it. However, the activity for the learners provided kind of feedback. It didn't meet the needs of or the intended objectives. So it might have met the targeted needs of the actual simulation scenario. However, the way it was devised, the scenario didn't meet the goals and objectives.
I
So,
wonder, I'm
mhm.
sorry, I wonder if this is more educational strategies instead of goals of objective, because I think that what this say is that did not met intended objective. That means that the strategy that I use, the educational strategy that I use, was not probably the right for those objectives. So that's my take.
Okay, so we can take that further in the stem of the question to looking to say, it doesn't note that the educational strategy, the modality of was an error. So if you could possibly, maybe I used, if I were doing um, IV insertion, for an example, if I had the modality of a fidelity human patient simulator or a standardized patient or an arm, would you agree that all those could possibly, depending on the SP, legalities and ethics and things of that of doing procedures, would you all agree that you could initiate or start or complete an intravenous access on any of those modalities?
Yeah,
Possibly. So it's
possibly.
not that modality or educational strategy. So the activity itself didn't meet those objectives. So then it's kind of think a bit more concretely with that to kind of go back to say, wow, our objectives weren't met. Why weren't the objectives met? Maybe it's the way I formed the objectives. Maybe our objectives were had too many, we didn't write them according to kind of a SMART goal or objectives using to describe, demonstrate, those type of things as well. So let me look into the chat here. Okay. We had a great dialogue with the targeted needs in the questions as well. So we've identified in the Kieran's model a gap or general, we just kind of did a umbrella scoping type of needs assessment, if you will, and the problem identification. It could be data, it could be talking to colleagues, it could be the literature. That was this general needs assessment. Then I need to go in and, gosh, in generality, we've identified that we need assistance with intravenous catheter insertion. I'm going to stick with that exemplar. When we go and look further, we identified that we have a targeted needs assessment to complete to meet objectives for an outcome measures. Okay. So when we think of anything that's related to goal and objectives of a question, kind of stick in that environment. If this particular question had asked about um, the activity did not meet the um, the identified problem or the identified targeted needs assessment completed by infection control or something, that's going to give you more and lean you in towards looking at the targeted needs assessment. Does that help you all?
To
So
be
that
honest, no.
okay. So
Because
when we think,
I can argue for implementation, I can
yeah,
argue for any of
we
them.
could
I
argue
mean,
for all of them, right?
yeah.
I agree with you. So one of the things is, so we'll kind of break it down to if we think of a problem identification, in general, what's the problem in healthcare that we see? What's the ideal approach that we're going to take to solve this problem in general? Targeted would more focus on then what are within this healthcare problem, and I have my targeted assessment. Who are the learners going to be? Who do I need to target with this problem? What's my learning environment going to be? Okay. So if I have this universal difficulty of we have infection rates going up, or we have patient complaints of a healthcare problem where we have low low success rate for first IV starts, and my patients are coming away all bruised or something, right? So that's a problem within my organization. So now I'm going to go ahead and develop a simulation activity. And so my targeted needs assessment then is, oh, my learners will be these persons who are putting in these IVs, intravenous access, and my learning environment is kind of what that area is. So then I need to think of, well, what are the objectives? What are those broad goals or those measurable objectives that we need to do to teach these learners to kind of come back and say, we need to correct this gap that we have. We have to improve our outcomes with IV sticks success rate. Gosh. Um, so then when we go through, we also need to look at then educational strategies. Well, how are we going to, what are our methods? What is the content we're going to provide them? Maybe we're going to do some videos. Maybe we're going to then prepare the learners for online modules. A lot of organizations do that. Whatever your learning content is, and then you could come and say, well, I want them to also possibly have some training, right? Maybe they do a skills check-off day, something to that effect. What are your strategies, those methods? How are you going to implement? So, do we need to look at barriers to implement this educational strategy? Do I not have the right equipment in my facility? How do I introduce it into the curriculum? How am I going to get everybody there for training, right? Do I need support in those environments to be able to implement it? So, surveying the scene that way. And then, how am I going to evaluate those learners? And then I also have to think of programmatic evaluation, right? So if it were satisfaction with intravenous vascular device access, maybe our satisfaction in our patients went up. Maybe my supplies, I'm not using as many IV catheters, right? So whatever those outcomes are, maybe that learning was successful. So not only do I have an individual learner feedback, but also programmatic feedback could be within this realm here. Let me see. How about that approach for helping to reinforce Kern? Anybody else have great ideas for reinforcing this particular model that you like to use? So if we're kind of going back through curriculum and I'm going to develop a simulation activity based on the needs assessment, what is that basic problem identification that universally we're seeing with our learners? And then how do I go to more targeted specific, right? I need to funnel it down and not be all over the place and try to have a gazillion objectives and goals that don't meet the targeted or that problem that we identified. Okay.
Can you
All right.
1 second to the question again, and
Sure.
then go and exactly go specific to what in the question itself got you to a specific answer? Because again, I still the way I have been doing the current circle, and I don't see it as one step at a time, but it's like everything is going in different directions. And maybe I'm reading the question wrong. Probably that's what's going on.
Well,
So what was the answer?
so for this, it's goals and objectives.
Goals and
So,
objectives.
yes,
Okay.
sir. So when we think about, you're correct. Kearns is in, we're presenting it, trying to have y'all present it in a way that is a linear fashion. So there's that understanding of each individual concept first. However, yes, it is multidimensional. One impacts the other, right? If we have a breakdown in one. But for focusing on these individual content items or each specific part of the whole will assist you because what you're being asked to do is then let's look specifically at that one area of the model that was the broken chain, if you will, right? Where we had an issue. Yeah. Okay. Everybody comfortable with moving? Did that help you, Hector, as well? Okay. Thank you so much. Okay. So this is a fun application that we're going to have, and this really looks at fidelity. So having the terminology, this goes back to a great resource of fidelity being the SSH dictionary, and then also looking at realism. And this one right here is here's a monitor on the right of the screen that looks at up the top here, the heart rate is 40, and we have a heart block. And then we have our standardized patient who looks very jovial and entertaining, and the two kind of are, wait, it discord with one another if you look at that, because I would be expecting to what have a patient in heart block look a little different than this standardized patient. So this is the monitor reveals an unstable patient with a complete heart block, and the standardized patient corresponds this way. So she's kind of has a smile. Based on these two factors, what does the simulated activity contain? Does the simulated activity contain a superior level of fidelity? Do you think fidelity? Remember, fidelity is the ability of a simulation to reproduce the reactions, interactions, and responses of a real world counterpart. That was a direct definition I was reading. Not superior. Perfect. It's not. Because it's really not, we're taught at the bedside to not treat the monitor, but the patient, right? So if we look at the patient, even they're like, wait a minute, they seem to be doing okay. Maybe my lead's off, things of that nature. So that fidelity is not there in here. What about realism? So realism, remember, is that believability, not believable. Why is it not believable? What do y'all think?
And just if you know the battle signs and what happened with somebody that have these battle signs, I mean, the battle signs don't even match. So
Okay, yeah.
yeah,
So there's
yeah.
that huge
So
disconnect, right? Well, this
yeah,
isn't
yeah,
realistic, is what your mindset is going. So when you
yeah.
do see this, that there is a discord, there's a discrepancy in that clinical presentation of the standardized patient and the demeanor and the actual monitor. So yeah, so conceptual. So what we're looking at is those different types of fidelity. So conceptual, functional, we're looking at physical and psychological fidelity. So having those terminologies in your mindset is great. And then the content isn't showing some urgency that I would definitely have, and you all are experiencing probably for a realism for the learners. So they're just probably going to be like, yeah, whatever. It's kind of like when they go in, I washed my hands, and they're doing this and they haven't washed their hands, right? So sometimes we want to create that to make sure that experience works well. All right, so this was well, there's a good thought. The learner then learns not to trust the simulation. So one of those things is as educators that we do have to make sure that we have those concepts together, right? Or we go back to our Kearns model and we look at our objectives and we go back to say, well, what if we're going to apply it to this, which one of these would we go back to because there's a disconnect? Maybe it's the training of the standardized patient, those type of things that we would do. But there's definitely this particular one is specifically looking at the terms fidelity and realism. So that's just a different way, I apologize, to kind of look at those concepts and how they could be relatable. And I know we've got about 2 minutes left because we've had such great discussions, and I appreciate you all including as well. Any thoughts, concerns? I leave the floor to open to you all for some last minute items or thoughts that you may have. And hopefully this was helpful again today to you all.
Is the thing that I'm having not trouble, but it's interesting to me is that I am overthinking these questions, and probably it's just as very simple what they're asking, and I am
Yes.
using, the
Okay.
experience, and it's against me. So,
Okay.
do
Don't
you have
get
any
the,
any do you have any tips
yeah. So
to
analysis
deal with this?
paralysis is one. Analysis paralysis where you're analyzing way too much. So the forest for the weeds or the trees, right? Don't get into the weeds. Look at the stem of the question. This is asking me this. So think of the level of the CHSE professional is 2 years, right? So we want somebody with 2 years experience to and beyond to take this exam. So you may have infinite experience from different ways from your knowledge of curricular design, teaching, education. When you amalgamate it with simulation, look at those questions because it's based on that type of learner as well.
Something I saw actually on one of my TikTok dives was it was a quick thing of a nursing student taking an exam, and the nursing student raises his hand, and the professor comes over and they say, I don't understand the question. It's asking me which one of these are the most correct, but they're all correct. All of the answers, A through D, are correct answers. And the professor says, well, the question asks which is the most
Most
correct.
correct. Yes.
But I don't get it. They're all correct. And so
Yeah.
I think that's kind of what I keep thinking of when I listen to Hector is, yes, you're right. They're all correct in some way, but which is it that they're most correct? Which is it that they're really honing in on?
Correct. Thank you for that. Because what would that prudent simulation educator advise based on just that concrete evidence that you have in that stem of the question? That's very helpful because we can maybe we'll dive a little bit more in that next week as well to do that. So, gosh, y'all, we're finished today, and I appreciate everybody's input. And please, if you have questions or concerns, please reach out to me as well. And then the content for this recording for week 3 will be available after the Zoom session is there. Okay?
Kelly, can I ask one more question?
Sure.
Just with regard, you might have answered this before, and it may have been my listing skills, but with regard to actually taking the exam, the notes that we've taken, like from the videos, what does the exam format look like with regard to accessibility to those notes? Are we committing these notes to memory? Are we able to use like a
You're
picture
going in cold turkey. Yes.
where we have to,
Bring in your brain.
turns, and that's it. There's
Yep.
nothing else that we have
No.
with us. Okay.
No, no notes, things of that nature. So it's all based on your practice. Yeah. Thank you. And
GPT.
our last our last session will go over those specifics too about that. And there's some great resources, available for how to set up and things of that nature. So that's a great question. So yeah, kind of go in with that you're thinking cap on in that way. Yeah.
Okay, great. Thank
Thank
you.
you for that. Okay. Hey, Hannah, thank you for supporting this video today and getting it ready for everybody as well, and go from there. And I'll talk about the practice exam next week because it is connected with your evaluation that you have as well at the end of the course. Thank you for asking that. Okay. Y'all have a good evening.
Bye, everybody.
Thank you very much.
Bye.